TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Randall, I'm really excited about spending some time with you. I've known you for a long time. I was just thinking about it, about almost 30 years, the work that you've done uh, and following and supporting the work that you do, and at the same time utilizing you in many of the areas that I'm interested in as a psychiatrist. Um, but I've not really had the opportunity to. I I want to really hear your story of what brought you to the work that you do that's so meaningful and impactful. And I not only will I learn from that, but the people that are going to be watching this interview, without question, it'll have an impact on them. So, maybe yeah, you can share your story.
Okay. Well, Dr. Barrett, it's always a pleasure, and I've really appreciated our relationship over the years. I've been enriched by my connections to psychiatry and psychiatrists and the work that I do. I'm an advocate, I'm a legislative advocate. Some people call them lobbyists, but there's more to it, particularly, I think, in my story. Um, I'm actually a second generation advocate. My mother was very active in the Mental Health Association. Actually did the same kind of work. She was with their legislative committee at the state level. And I joined NAMI California, National Alliance for the Mentally Ill, and became very active in their statewide efforts and finally became their legislative director. But there's a story behind that. I was always interested because my mom brought stuff home. When I was in high school, at the dinner table, right, I'd hear about politics, and I would hear about mental health issues and how the two came together. My mom was instrumental in helping set up things like a women's center in the greater Sacramento metropolitan area, and a suicide hotline, and a number of things. So I kind of learned at the dinner table in some ways what the advocacy process was like. But it wasn't really until my son was diagnosed with schizophrenia that I kind of pulled it all together. Because I'd done some activities when I was a student at UC Davis, and we helped reform the media boards on each of the 9 campuses at that time, because there was restrictions on free speech from the era of the free speech, all that ferment and activity in Berkeley and elsewhere. And so I actually became very conversant with how you work with large institutions, because UC is huge. You've got the regents, you've got each chancellor, you've got guidelines for media, and I learned kind of process issues there. And this was when I was still very young. But I helped actually establish a house in Davis while I was still a student for mentally ill individuals of college age, where we used a model where we brought in students who were quote unquote normal or regular students. And then we brought in those individuals who had diagnoses, and we all lived together collectively in the house. So I started early. I think that was before I was actually legally able to drink, at 21. So, but jumping fast forward, this my story really starts. I think that with that background in mind, my story really starts with my son and his diagnosis at the age of 15, with a psychosis not otherwise specified. Long story short, there have been a series of incidents in our family, what we know in psychiatry as prodromal kinds of um, uh, circumstances and symptoms that eventually work up into a final diagnosis with a severe mental illness. And so he was hospitalized, as I said, just before he was 16. And when he was stabilized, the diagnosis explained a lot to me, made a lot of things more understandable about his behavior, and how he reacted and interacted with the world. And I will never forget that when he was leaving, he was being discharged from his first hospitalization. The psychiatrist, who was a very reputable child psychiatrist, says, now comes the hard part. I had no idea what he meant. But so we struggled I was a single father. I was his sole source of family support. And we struggled to try to figure out how to get along together, and that was not very successful. I knew nothing about severe mental illness. And so when that kind of thing, strikes, you look for answers, right? And so I would I would interview his psychiatrist and say, "What's going on? Why this medication? What about these symptoms?" Trying to teach myself, and that was partially successful. But then I found NAMI, National Alliance for the Mentally Ill, and they offer a course, which is basically a 12-week course as a survival kit for families. And so it teaches everything from brain physiology and function to medications to coping strategies to advocacy. And the advocacy part really interested me because while all this stuff was going on with my son and I was feeling overwhelmed, advocacy actually offered a little bit of relief because I could feel good about advocating for other families, for other people, and become involved in trying to improve the care because as we, of those individuals and the families, because as we um, my son and I matured in our relationship. It was very evident, I was never not going to be a NAMI member. He's not going to get over being schizophrenic. He's not, ever going to be cured. There's no cure.
So it sounds like, Randall, not only did you have a history of advocacy, so you had a leg up that this was an area, but what I just heard, advocacy served as a therapeutic piece for you
Yes,
in this
absolutely.
struggle of that your story is the common story. Uh, I would hope we're a little better today, but I'm not so sure we're a whole lot better in that struggle when you have that family member that's afflicted with a condition like schizophrenia,
Yeah,
psychosis.
yeah.
Um, but that therapeutic piece for you, I mean, you found some solace
Yes,
in.
yeah. It does make me feel good. I mean, lobbying and policy making in and of itself can be very stimulating. If you find something you're interested in and you think that the work is worthwhile, the sense of engagement, the sometimes the drama of it all it can be very stimulating just by itself, is separate from the mental health issues. And so there's always that. But at the end of the day, my first two projects came out of my own personal experience, and I think this is true of many advocates. Those who've had family members who are in and out of jails become expert in how families and mentally ill people are treated in the carceral system. And in my case, there were two things. One was the fact that because of personal circumstances, I was between marriages, had given up my house, was trying to find insurance, and couldn't really get good insurance with good mental health coverage. And I started to investigate that. And I found out that at that time, you could have policies that restricted the amount of inpatient care you could get. So maybe $25,000 was like the cap. And I thought, I wonder how much it costs my son to spend 2 weeks in the hospital and whether we could pay for that. And the answer was maybe and maybe not. And this is a real problem because if you have a heart attack, if you're being treated by, for a number of different diseases and you have to go into the hospital and receive intensive medical treatment, it can cost $100,000.
Right. Yeah.
And I'm going, what's up with that,
Yeah.
So I helped put together the state's mental health insurance parity bill, which basically says, that mental illnesses, and there was a list of them in the
Right.
bill, the severe ones had to be treated on the same terms and conditions. And I just thought that was just so necessary because otherwise families go bankrupt.
Mhm.
You have a second hospitalization, you've already used up your savings, right? And so where do you turn? You remortgage your house, right? And then eventually, some families would go bankrupt.
So it was that personal experience that you saw what was happening to your financial.
Yeah, I mean, I didn't have it bad. I had a tough time, but it caused me to wonder why we don't take better care of people in terms of the insurance that we give for the treatment of their mental disorder.
Right.
And, it's striking. It still exists to a certain extent today. We've eliminated some of those numbers and the caps and the limitations, but we're still fighting other battles with the health plans and insurers. So the advocacy goes on, even though we got a really good start. We had one of the strongest bills in the nation here in California when we achieved the governor's signature, which was not really easy to do.
Easy,
It took
right.
us 3 years, but
Well, thank you. So, I mean,
yeah.
no, we are in a better place because of that effort. How was that effort for you? I mean, as you look back now, from the time you began that concept to the governor's signature, um, it had its
Had
ups
its
and
ups and
downs.
downs.
Yeah,
It certainly did.
yeah.
I had no concept of legislative
Okay.
strategy. I was new and starting out. I just knew that I had a personal story, and our author at that time, Helen Thompson, Assembly woman who was chair of the Health Committee, said, "Tell your story. We'll take care of the rest." And I learned basically watching how a well put together political operation works with issues like this. It took us a while, but I learned by doing, and I learned by standing shoulder to shoulder with good legislative staff who are also committed and who are also family members. That's what I found when going around the Capitol and talking to offices. About every third office has got somebody who's willing to raise their hand and say, I've got somebody in my family who's affected. So it's everywhere.
Right.
And I think that's the thing that I've learned is that just starting to tell the story opens up the door for other people to talk about it too. And the more that we do that, I think the more we normalize the fact that mental illness is part of a lot of lives,
Hmm.
everyday, lives that happen and go on and have success or not. And that's where I come in is I want those lives, the families and the individuals and the psychiatrists who treat them. I want those to be successful encounters.
Right.
So
Right.
I'm always looking for problems. You
Yeah.
might say I have a negative emphasis in
Yeah.
doing that, but I'm in the business of solving problems.
Right. Y- as I look back on my career in psychiatry and mental health, it almost seems that anybody who's in this field, they may know it or not, is an advocate, is engaged in policy, uh, and mental health is such an open canvas that almost any piece needs an advocate and somebody who's trying to improve an outcome, be it a nurse, a family member, the person impacted by the illness, law enforcement. You could
Psychiatrists.
psychiatrist.
Yeah. Yeah.
Yeah, I mean, all of us, are advocates because we're wanting the people we work with to get better, and we know that there are many system barriers, and we've got ideas. Oh, why don't we try to utilize this strategy versus that's right. What can we do better? I mean, you know, I'm going to call you an expert as an advocate and a policy. I mean, really, you know, you understand the nuances of how to move things forward. What can people who are in mental health that work in that space not just support you, but do on their day-to-day, work?
There are tons of things depending on the time you have and your inclination. The factors that led to our success with the parity legislation, as well as like assisted outpatient treatment,
Hmm.
Laura's Law,
Right.
which is the other piece I worked on that we were also successful with. There's a number of different pieces to that. One is that we ended up learning how to work with the media.
Okay.
And sometimes for any individual starting out, all that means is, I really like that article. That person wrote a really good article about mental health. And I say, send them a message that says it's an attaboy or attagirl message, right? Tell them good job and strike up a relationship. Tell them about your experience and tell them what your story is and say you're available if they ever need a source. So developing the media, which will right now, mental health stories are hot topics, right? Also, mental health as an issue is polling really high with the public.
Okay.
So now is the time for people to develop these strategies and start working on issues. And we see more and more families and psychiatrists and everybody kind of doing that. But it's really a matter of being able to tell a story, a coherent narrative, and then being able to say, I think the solution is, and then having done a little bit of homework, you say, we need Laura's Law to be implemented better. Or the next step in parity is actually getting plans to approve medically necessary care without all these prior approvals and all these roadblocks that corporate, delivery of healthcare can put in the way of actually getting that healthcare. And so, I think connecting with others who feel the same way you do, whether it's through psychiatrists, through the psychiatric associations, or whether it's families through NAMI, or even some other groups that are out there, find people with a common purpose, start learning, develop some expertise,
Right.
because I became also became an expert in jails, and
Right.
and I turned around and shared my expertise because my son was arrested a lot, and I'd show up in court. It's like I didn't, it's a little scary, right? You're a family member. There's the court. There's the judge.
Yeah.
They got these big calendars. You're trying to see if you can get your son into a mental health program instead of jail, and you don't know at the end of the day whether
Yeah.
you'll be successful. But you learn by doing.
You know, as you were talking about that law enforcement engagement, and even if somebody wrote an article in the media, just that was a nice article. I really want to thank you. If I was the writer, that would have such a powerful impact on me. It would keep me motivated in that space,
Mhm.
that I had an impact on a reader. And I'm even think as a law enforcement, if hopefully one of those engagements that your son had with law enforcement was semi-positive, imagine an email to that law officer saying, that was quite compassionate in your approach, and I
Mhm.
really want to thank you. You know, he uh, he's 25, he's 30 years old, he's a young, lieutenant in the police department. That would go a long ways, and I'm sure that person will remember that thanks.
Yeah.
So every one of us, when in mental health, we've got to embrace just that's an advocate. That email to me, you are now an
That's
advocate. We
exactly
could
right.
imagine if everybody who has any involvement in mental health took that upon them
Yeah.
a few times a year
Yeah.
to it. I think we would be here
Yeah.
rather than
It's the
yeah,
relationship building which is important. It could be the media, could be, as you say, law enforcement, could
right.
be your local city councilman, your
Yeah,
county supervisor,
right.
even, somebody within the school system, because I mean, mental illness is an equal opportunity offender in some ways. It pops up everywhere,
Yeah.
right? So its manifestations will be felt in all of those different
Mhm.
areas. And so I um, emphasize the long-term relationship that
Mhm.
you will build.
Right.
And one example of that is working with Dan Moraine at the LA Times
Right.
way back when.
Mhm.
He was also a family member, so he was
Yeah.
interested.
Right.
He has a brother who has had issues with institutional care. So we got together for an interview. He did an article. I said, I really like that.
Mhm.
I got some other friends. Let's, if you need to talk to somebody about other stories, I can always help. And so we developed a relationship, and that was, 25 years ago. And
Mhm.
Dan and I still stay in touch. And I still send him saying that is the best thing anybody's ever
Yeah.
written on this particular slant.
Right.
And he knows me well enough because he respects my expertise. He will say, coming from you, that's quite a
That
compliment. And
that
so that's a relationship.
yeah.
It's a very positive one.
Right.
And Dan has used his, quote unquote pen, if you will,
Yes. Yeah.
for a lot of really good. It's helped open up the ability of the general public to see these issues
Mhm.
in compelling personal stories that are also, have policy implications and there's some research on some of the problems, and you put them all together and you've got a great story. And he does that. And there are other people who do that really
Yeah.
well too.
Yeah. I mean, that, so often in this space within mental illness, it can be adversarial
Yeah.
and antagonistic. Like, you've got to do this. And I think we can go much further if we're positive and we recognize something or someone who's done something well.
Yeah.
I I think you'll get more bang for your buck in that
Absolutely.
with that technique,
Yeah.
be it a legislator that's, letting them know you're there. If some issues come up, please feel free to,
Hmm.
make contact with me. Uh, and, regardless of how you view this area, you know, but if there is something, really, share with
Yeah,
them.
yeah.
Yeah.
So
Yeah.
the personal relationship part is a key and central part of advocacy, because eventually, if you get to know your local city council member and you're talking about what you're seeing on the streets, say of downtown Sacramento, that's really awful. You get people that need treatment and nobody apparently is paying attention. People just step over them when they're sleeping
Right.
on the sidewalk, and you start to talk about, well, why is that happening, and you ask sincerely, not blaming anybody, but you're looking for answers. You can develop those relationships, and those people in the city council level, like Daryl Steinberg started there, eventually go up and they become lawmakers who help establish state policy. So it can have a lot of dividends, those relationships. So relationships with media, relationships with elected officials, relationships with treatment providers. And I worked really well with the psychiatrists from the California Psychiatric
Right.
Association. And it was such a natural thing for a family member and a psychiatrist to team up and go in and talk to a lawmaker. So it's important for family members on the one side and psychiatrists on the other to connect with the natural constituencies, which is, families. And in some cases, we had stable consumers who would join us, and that's like a dream team. You go in and you talk to a legislator, and you've got somebody with schizoaffective disorder, you've got their mother, you've got a psychiatrist, and so you've got the family member, the ill member, you've got the treatment provider, and they go in and they make the case for, whatever. Laura's Law,
Right.
and we worked on so many things
Yeah.
since then. Getting our police better trained. I helped develop curriculum for
Right.
for police agencies to do that.
Right.
And we reach out and we talk to hearing officers who are some of the people who conduct the legally required hearings that our laws require if you're going to involuntarily treat people.
Right.
And it's not always about involuntary treatment. You always prioritize, voluntary buy-in on the part of the individual towards their, betterment of their symptoms and treatment for their condition.
Right.
So
Yeah. Again, as I was hearing sort of your story and how people can get involved, on the flip side, sometimes the word advocacy policy can be daunting.
yeah,
Like, I'm not skilled. I'm not comfortable speaking to media or going with an expert like yourself and or a family member in front of a legislator. I don't quite know, you know, what to how can we make that less daunting? Not everybody needs to think, oh, you have to think on the legislative level, but just on the on the ground level. That this is fun. This can be something that you can incorporate into your daily clinical practice. It enhances it. It makes you feel more passionate about what you do. Any thoughts? You know, making it more not straightforward.
well, first of
Yeah.
all, you wouldn't know to hear me talk, but I have a little bit of social phobia, and it's hard for me was hard for me to speak in front of groups.
Okay. Yeah.
But you got to go out and do it, right?
Okay.
And you're going to have awful moments where you freeze,
Right.
and your bill is about something really important like Laura's Law.
Okay.
or some involuntary treatment laws or preventing care, and we
Hmm.
need to fix that.
Hmm.
And you freeze and you think, oh my God, nobody's ever going to ask me to be there. You gotta step up and do it. I
Okay.
mean, you got to find the courage within yourself,
Okay.
and I think most people can do that.
Okay.
And so it is a little daunting, but like I said, you have to find people who are like you,
Hmm.
and take the support of other families or other psychiatrists or
Hmm.
other lobbyists even, to learn.
Okay.
And I had mentors, right? So I had
Okay.
people who'd been there, done that, and then they were able to turn around and treat
Right.
me like somebody who needed a little education and support. But I was basically taught a lot of how to do this by people who've been doing it 5 or 10 years before I got involved.
Mhm.
So it's important to find mentors. But you institutionally, NAMI does an advocacy course
Okay.
for family members. So if there are family members who need to learn the fundamentals of legislative advocacy, there is actually a framework, a specific framework that NAMI does, and puts people through a training. And
Okay.
I've done the same thing for psychiatrists.
Hmm.
Um, I'm often asked to speak to inform people about what is going on in Sacramento.
Hmm.
And it's not only exciting to hear about all the good news and some of the challenges that we're hoping to overcome, but it's also a good thing to sprinkle in the how you do it,
Hmm.
right? People are always interested in a good story. So when I tell Laura's Law stories, it's great, right? But when I do that, I say, and I can give you tips to how to take a 10-minute legislators meeting,
Hmm.
and you'll be really glad that you got my tips, and you'll be really good at it. When you're done, you're going to feel good about what you're able to do. And so I sprinkle in some helpful advice. So I do some trainings.
Hmm.
I'm going to go back to Annapolis back in February,
Okay.
and I'm going to talk to people about assisted outpatient treatment and how we did it in California, and what I would suggest other advocates who are interested in other states do, and how to do it, how we did it.
Okay.
So, it becomes part of passing along,
Okay.
the received wisdom of those who followed before you.
There are certainly some core groups that you've worked with very closely: psychiatrist, pro- maybe psychologist, maybe other. What are other groups that you'd like to tap into to bring into this world of mental health advocacy that are, you know, beginning to engage with individuals who need better mental health care? Any sort of groups or organizations or
Well,
age? Mhm.
yeah, I've got some ideas
Yeah.
about that. I think we've worked over the years to ensure that we've collected people who have a natural interest in this. So family
Hmm.
member organizations, but each of the family members, they may have a business, they may
Right.
go to church.
Sure.
Other members of their family may be in a school, so you can reach out into those settings and start again to establish connections, do education, find common ground,
Okay.
and work together on specific instances. There's nothing like, being able to talk to a school administrator about why their approach to behavior problems shouldn't be punitive because they
Right.
don't really understand that the individual has a biological brain disorder that's causing them to maybe act out a little bit or be difficult or not be able to learn or whatever.
Right.
So you start where you are, and then you
Yeah.
reach out to those natural constituencies. When we
Mhm.
got support for Laura's Law, we got the Archbishop of the diocese in Los Angeles of the Episcopalian Church to actually write us a letter of support because somebody
Yeah.
knew them. They were regular churchgoers, and
Right.
they knew the Archbishop, and they
Right.
asked, and that
Yeah.
the rest is
Great.
history. So wherever you are, you've probably got the makings of development
Hmm.
of constituency. So in those areas, but law enforcement's important
Yeah.
too. And we're
Yeah.
learning so much more about veterans these days
Right.
too, with their issues. And so it's probably right there staring you at the face.
Yeah.
Um,
I mean, those three places you just mentioned, law enforcement, you know, uh, houses of worship, uh, and our education, if they become regular advocates to support you on the front line and policy, that you could reach out to them, could you help me put this letter together? Here, I think, what would, I can't imagine what that would add to, the person receiving that.
yeah.
Um, yeah, that,
Yeah, no, I mean, if
right.
you got a superintendent of schools in a
That,
local school district or at the county level, and they decided that amongst the many other things they
yes,
have to do, they
right.
wanted to do that, that
Yeah,
would be very effective.
yeah,
And you may know administrators and you don't
right.
have that relationship, but you make a goal of setting out to get to
Yeah,
know them,
right.
to understand, the issues that they have and how it's impacted by the
Yeah,
things you're caring about.
yeah,
And then you have common ground. You
right,
establish a bridge of connection
right.
between you.
And when you need some support, I can reach out to you,
Yeah,
and I can use your name
yeah,
and or,
yeah,
a letter of support.
yeah.
Yeah,
When
absolutely.
when I when I talk to psychiatrists, they always ask how my son's doing, and we have a little conversation,
Yeah,
and I get advice. And I would never get that advice, in the strict
right.
make an appointment and come see me setting,
Yeah.
but it was casual. It's kind of in a framework of almost
And
friendship.
then I wouldn't be surprised, it might even have more impact than
Yeah.
just in the clinical appointment
Well,
setting.
this happened to me yesterday. I talked
Right.
to a couple of psychiatrists, and I thought, I need to make some phone calls to
Yeah.
make sure that my son is properly
Yeah.
taken care of, and it is happening, and so I'm very grateful. But again, it goes back to the relationships you have. I think advocacy can happen on the individual level. It can happen on the level I work with state legislature, and it can happen working with Anthem Blue Cross
Okay.
and the medical director there, and why they don't have early psychosis intervention programs for their beneficiaries. They could be doing so much good.
Yeah. Hmm.
They could be helping facilitate early intervention in psychosis,
Hmm.
which is so critical
Yes.
to outcomes later in life.
Hmm.
And you start where you are.
Right.
Yeah.
Well, any final words on how we can help you, continue your energy, your stamina, your passion, not to slow down. I'd say even work harder. We want to be there. Um, what what would you like to tell the audience of how we can do more to help the work you do?
Well, I mean, I think that it's important to become involved in something that has to
Okay.
do with mental health. Just choose something. So I'm on the board of an organization that provides financial planning for when
Yeah.
parents who are providing care, end up passing away. And who's going to take care
Yeah.
when I'm not there is what we do in that organization. We do the financial planning, we do kind of case management and social services too. So that a person could look for the Planned Parenthood Foundation, where I'm on the board, and they could connect.
Yeah.
And I'm on a board for a treatment advocacy center back in Arlington, Virginia. They promote assisted outpatient treatment. Take a look at their website.
Yeah.
You know, when I work for psychiatrists, if you're a psychiatrist and you're listening
Yeah.
to this and you want to get involved, just get in touch.
Right.
I'm at empiricalpolicy@gmail.com.
Okay.
And people can always reach me through that email. And then we can go from there.
Yeah.
I will custom tailor a
Right.
advocacy
Right.
program for them if they'd like,
Exactly. Yeah.
So
What I hear, don't overthink it. Just you have an idea or an area of interest. There's going to be a space
yeah,
to be an advocate.
yeah, there will be, inevitably.
Yes. All right. Well, thank you so much.
Well, thank you.
Yeah,
This has been
yeah,
fun.
you bet.
It's been fun.